Mararget Gleason, Vice President of Home Health and Hospice Operations, and I work for Provena Life Connections. I am pleased to announce telemonitoring to our home health and hospice operations. Patients who have a primary diagnosis of COPD, diabetes, or congestive heart failure are candidates for our telemonitoring program. The one criteria is they must be able to work the machine, or their caregiver or family must help them work a machine. One great thing that happened is that we have a patient who's legally blind, and she was actually able to work the machine better than she was with our previous congestive heart failure program. Our home care patients are empowered to manage their disease process and to stay at home rather than returning to the emergency room or the hospital. Telemonitoring for the physicians is an extension of their practice, and they're better able to manage their patients in the home 7 days. Well, during our second day of telemonitoring training, our nurses went and put a patient on in Joliet, and were able to do an intervention. Her pulse ox, which is her oxygen saturation, was down to 77%. It should be around 98. And they were able to do an intervention, increase her oxygen, call the doctor, let him know what's going on. So we were really excited. It empowered our nurses and empowered our staff who were training it. Our nurses are excited about this new technology so they can better able manage their patients 7 days a week in the home rather than 1 or 2 visits a week, and to keep the patients out of the hospital. Our referral sources should choose Provena because we have the highest quality and the highest patient satisfaction. And also, due to telemonitoring, we can work together as partners to keep the patients at home and out of the hospital. Our vision is to cover all of our home health and hospice patients, and then eventually in the future to explore other avenues within our service lines where it could be applicable.